Hello, everybody. Happy Friday. We're at the end of another long week. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. We are at our Keeler Memorial building in downtown Mobile here to give you an update on the impact of the COVID-19 epidemic on Mobile County, our residents, our visitors, our businesses. So we'll start with the world numbers. Worldwide, there's been nearly 42 million cases of COVID-19 with around 1.1 million deaths. In the U.S., we are approaching 8.5 million cases of COVID-19 with just over 223,000 deaths. And again, the U.S. is still leading the globe in the number of COVID-19 cases and deaths, followed by India and Brazil. In Alabama this morning, there were 180,916 cases of COVID-19 reported with 2,859 deaths. So in Mobile, today our daily report is providing information on 16,887. That is an increase of 2,381 yesterday, and I'll talk a little bit more about that in a minute. First, to mention that 317 have died with COVID. That's an increase of 1 since yesterday. And the cumulative number of people in Mobile hospitals with COVID-19 is 2,223. That's an increase of 11 since yesterday. Again, we're seeing most of the increases in transmission happening in younger age groups. Currently hospitalized with COVID, yesterday there were 72 people. That was flat from the day before. So we are glad to see that the average number of people hospitalized on any given day with COVID is staying in the 70s. It crept up to in the 80s about 10 to 14 days ago. So we're glad to see it back down in the 70s. So then, to address the enormous spike in cases that were reported on 10/22 for Mobile County residents, I'm just going to read our statement that we have reposted from ADPH, that the Alabama Department of Public Health processed a backlog of 2,565 positive antigen results from a single facility in Mobile on October 22nd, yesterday. Because these are antigen results, they will be classified as probable COVID-19 cases. And even though the tests were performed during June through October 18th, they will always show up on our reported date as October 26th. This in no way affected patients finding out their results, right? They got their results in June or July, August, September, October, whenever they were tested. But the provider was unable to tell us about the test result, and ADPH found a way to process those reports as if they were a lab report and get them into our queue. So the facility had been reporting the people, but had not been reporting the lab test. And so again, we worked with ADPH. They were able to find a technical solution to that,